Okay, good afternoon. My name is Dr. Clement. For those who don't know me, I'll be talking to you today about a topic that is often, it's actually a medical emergency because when the flow of blood is lacking for whatever reason, the flow of blood to the cells, let's remember the cells, that's where metabolism takes place. The cells grouped together, they are called a tissue. Think of blood lacking to the tissue. Remember, blood carries two important, shall I say, agents. Carries oxygen, without which those cells will not be able to carry out metabolism, the constructive and the destructive processes, which are so necessary for generation of energy. So if there's no oxygen, that will be a failure. Those cells, they need nutrients to be able to carry on. In fact, what is being metabolized, broken down, and all those are nutrients. So now, if a group of these cells, known as a tissue, is not getting it, it's not getting a full supplement, or shall I say, blood that it is supposed to get. A group of tissues would constitute what is known as an organ. If that organ doesn't get blood, this is the problem. A group of organs would be what is known as a system. If that system fails to get blood, then it means the metabolism which is supposed to take place in the system is going to be a failure altogether. Now, these, you will ask, what causes this lack of this blood flow that is lacking? What could be the cause? Well, quite a number of things would be responsible for this. Like, for instance, if the heart is failing, for whatever reason, whether the heart is caused by what to fail, this could be given a special name. We would say this is a cardiogenic shock. In fact, when blood is lacking in the cells, in the tissues, in the organs, in the systems, that's a shock. So this would be a cardiogenic shock, because now it's caused by the failure of the heart. It can be caused by whatever. You remember, the heart has to be a pumping blood to all the organs of the body, to all the cells of the body, including the heart itself. It must come to the myocardium of the heart. So if the myocardium doesn't get blood, So there's going to be a development of what is known as myocardial infarction. The cells will actually, the cells on the myocardium will actually die. And that will result in heart failure. That. And so a cardiogenic shock will be precipitated, which is not what you want. So a shock, cardiogenic shock. Is that the only reason? The answer is no. If the patient experiences an allergic reaction, suddenly the blood flow is interrupted. And this is what is known as an anaphylactic shock. This is a shock because blood is not getting to the organs. Blood is not getting to the tissues. Blood is not getting to the cells. Blood is not getting to the system. So this is a shock. Anaphylactic shock. It's not like a cardiogenic shock. This is different. Anaphylactic shock. Sometimes part of the, there's something called DVT, deep venous thrombosis. If a part of it gets broken and a part of it travels with the blood, and it goes straight to the lung and it blocks there, it causes what is known as a septal embolus. It obstructs, so to say, the blood to go. So that is called a septal embolus. So this is embolism, a pulmonary embolism. Pulmonary embolism obstructs blood. So blood will not be able to go through that septal embolus. It will not be able to go through. It will not be able to go through. And if it's unable to go through, some parts are gonna suffer from lack of blood. And this is called pulmonary embolism. This is what is known as an obstruction shock. An obstruction shock. Is that all? The answer is no. What then could cause lack of blood delivery to some parts of the body? What about an infection? Bacterial infection, fungal infection, viral infection. What about that? That once the bacteria, they get into the blood, the viruses get into the blood, the fungal organisms, fungal infection goes straight into the blood. That is called, it's given a special name, that is called septicemia. So a poisoned blood. The blood is actually poisoned by these bacteria, by these fungi, by these viruses. Poisoned. And that condition is called septicemia. Septicemia is a problem because if it progresses, the body is not going to like this. Remember, bacteria, they are foreign organisms. Fungi, they're foreign organisms. Viruses are foreign organisms. They enter the bloodstream. They enter the body. So the body is going to react to this. When they react, this reaction is called sepsis. Septicemia, sepsis. Sepsis is a reaction, an immunologic reaction. And immunologic reaction, when you think of an immunologic reaction, you're thinking of innate immune reaction. You're thinking of adaptive immune reaction. But what's the first one? The first one is innate immune reaction. And this immune can be very bad because it means you'll be calling dendritic, bodies, dendrites. Dendrites, which will be recruiting macrophages. And macrophages, what are they going to do? They're going to liberate their cytokines and the chemokines. And those, we don't want a cytokine storm. A cytokine storm can be very injurious to the tissues, can damage the tissues. And this is not what we want. And sepsis, so to say, can actually give rise. Actually can end up with death. This is damage because we don't know which part of the body is going to be damaged. So sepsis can be bad news. Patient can die. So septicemia, sepsis, and then you can end up, it can even progress to a septic shock. A septic shock, we're worried about one thing. Oh, drop of blood pressure, hypertension, blood pressure. Once there's that, we are now faced with a situation where the heart will not have blood to actually pump. It will not have, the hypertension. There's no blood to pump. So exacerbating this shock. Remember we said shock is when the blood flow is so interrupted that it doesn't get to the cells, it doesn't get to the tissues, it doesn't get to the organs, it doesn't get to the systems. So that kind of interruption is we can't stand that. And a septic shock, that's exactly what it's going to precipitate. It's going to precipitate hypotension. It's going to say, the brain cannot afford not to have blood. It can't afford not to have blood. It's going to stop everything else from having blood. Stop everything else. It will, so that it can have blood. You must remember, the brain has the respiratory center. The brain has the cardiac center. Those can only function if there's blood. If there's no blood, if blood carrying oxygen and nutrients, and they can't operate if that's not there. This is a massive problem. So shock is a problem. Septic shock, you'll ask, what will be the cause of this septic shock? We said bacteria, viruses, we said fungi, they can go. Which bacteria are you worried about? I'm worried about these gram-negatives. E. coli, for instance. I'm worried about protease. I'm worried about, I'm worried about Bacteroides. I'm worried about Enterobacter. I'm worried about, those bacteria, the gram-negatives. They are the ones which actually generate the septicemia. Even gram-positives like Streptococcus pneumoniae, like Streptococcus pyogenes, like actinomyces. So all those are gram-positives, but they can generate septicemia. They are the ones which are responsible for the septic shock. You know, septicemia, we said, septicemia, sepsis is a reaction to septicemia. Bad news, because it brings about cytokine storm when the innate immune system is reacting to this presence of these bacteria, which are very much foreign. This is a problem. This is a real problem. And I'm worried with the type of shock that is generated. We said shock can be generated, if we were to go over this. Shock can be from failure of the heart. We call that a cardiogenic shock. Shock can be generated from anaphylaxis, an allergic reaction. We said shock can be generated from septicemia. Septicemia which progresses to become sepsis. Sepsis which is a reaction to the presence of septicemia, of the bacteria which are there, the fungi, the viruses. You know, so generating what is known as septic shock. So septicemia, sepsis, septic shock. Patients normally die. You know, they say in 5, if you have got 5 patients, 1 is surely to die from a septic shock, from shock generally, from shock. So shock is a medical emergency. People should jump for this and make sure that those bacteria are actually treated. Of course, bacteria, we normally use antibiotics to treat them, but it's important to know what type of a bacterium you're talking about. Are you talking about a Staphylococcus aureus, which is pyogenic, which is pus-forming? What are we talking about? Are we talking about Streptococcus pneumoniae? Are we talking about? So the choice of an antibiotic depends on the type of bacterium you're talking about. Are we talking about Bacteroides, which is a gram-negative? Are we talking about Pseudomonas aeruginosa? Pseudomonas is one of those gram-negatives which are quite common in generating septic shock. Pseudomonas aeruginosa. You know, these are the, and if you attack them with antibiotics, they normally yield to antibiotics. Well, you can use cephalosporins, depending which type, like for instance, things like cefazolin, ceftriaxone, one can use those to try and go against these bacteria. And the other important, the aminoglycosides that you can use. The aminoglycosides that you can use, the gentamicins, IV gentamicins, topramycin, you can use, those are the ones that you use for as aminoglycosides. You can also use clindamycin. So these are the IV ones that one can use to go against this bacteria, because this bacteria can be very much resistant if you don't use the correct antibiotics. I am gonna wrap up now just to make sure that septic shock or any shock is gonna be regarded as a medical emergency. And because there's this big problem of blood or fluids not getting to the tissues, that is why our attack is always IV. It's always IV. Even if we're giving antibiotics, we give them IV because we want to rehydrate these patients who are dehydrated. Remember, if you are losing fluids, the problem here is lack of fluid to the tissues, is lack of fluid to the organs, lack of fluids to the cells. That's why you have to give your IV antibiotics. Like you've got to put up a drip and give these IV antibiotics or these fluids, right? And of course, knowing that there's this chart of hypertension, depends on the stage, actually. Early stage, you get oliguria. You get a fever, very bad fever, at 39, 38, 39 there, degrees C, and you want to make sure that these patients, they get rehydrated, because they are dehydrated by losing these fluids. In fact, the tissues not having fluids, the cells not having fluids, the organs not having, the systems not having fluids. So you want to make sure now that they are rehydrated by putting up a drip. And you can make a difference. And just by knowing that what type of organisms are you dealing with? Am I dealing with gram-negatives? E. coli, for instance, protease, for instance, the Klebsiella, Bacteroides. You need to know the type of antibiotics that or to use against which Pseudomonas aeruginosa. That is very helpful to know that. And all the time, what should be at the back of your mind is that I am dealing with a problem where flow of blood to the tissues is a big problem, where flow of blood and flow of blood to any organ of the body, flow of blood to any system of the body, if it's a problem, you know that metabolism is going to be a failure. So you don't want that. That's why you want to make sure that you interact so that there is no shock, and it's always a good idea again to know what type of a shock are you dealing with. Are you dealing with an anaphylactic shock where there's an allergy? What to say? Once you say allergy, allergic to what? You've got to make sure that you take the patient away from the substance. If you have isolated the substance that the patient is allergic to, so that anaphylactic shock can be taken. Of course, it's quite interesting to say When I'm dealing with antibiotics, I must know the type of organism that I'm treating. Am I treating a pyogenic bacteria? A pyogenic bacteria is a pus-forming bacteria, so the think of things like cloxacillin, to try and address the problem as it is. So I want to say thank you very much, and I would like to say I'll come back with something else, for as long as you know that a shock from whatever source, whether it's cardiogenic shock, whether it's an anaphylactic shock, whether it is a septic shock, it's the interaction of blood not getting to the organs. And this is something that needs to be addressed, forthwith. Make sure that this is done, because, if it's unaddressed, normally patients, they die, poor patients. And so a healthcare worker has to be armed with whatever, like the antibiotics that you need, the antifungals that you need, if, for instance, it's a fungal infection. Thank you very much.